So now we'll hear from David speak about House and how he goes about writing someone who has a serious drug addiction.
Thanks, Neil. Happy to be here tonight. It's great to be here at the Guild. As I think about, as in the 6 years we've been writing the show, as I think about how we've thought about House and his use of pain medications, I've never thought of it as writing about a character who's addicted so much as writing about the gray area of several forces in House's life, and they're sort of all in that clip. The three things that most frequently we think about are, one is he's someone who has real pain. He has debilitating pain. He's had damage to the nerves and muscle in his legs. He has real pain, which in and of itself is clouds one's judgment, makes it difficult to work, leads one's personality to change, causes one to act in certain maybe irascible ways. And there's another thing that we often think about is, House is someone who clearly struggles with mental health issues. He's clearly someone who's depressed. He's clearly someone who has some personality disorder. We can debate whether he has a narcissistic personality or an antisocial personality, but he clearly has mental health issues, which also push his personality in those directions. And the third thing that we usually think about is he takes pills because at times he's taken pills because he likes to get high. It's fun. He enjoys the high. And I think that when I think about writing those aspects of a House script and a House story, it's that gray area between all three of those that House lives in, and that's his real life. And I think that the interesting thing, storytelling-wise, is life in those gray areas and how those different forces mix and push together differently each week and through different plot lines and storylines, and how, sometimes different aspects win and sometimes other aspects win, and how that affects his decision-making and his choices and his relationships with the people in his life. And, we've written stories in the 6 years that highlight all different aspects of that. One thing that I would add on the more global issues around, it does, as someone who has worked as the medical director of an inner city detox, I'd say it does my heart great good to see the Guild having an event that talks about addictions, because it has long been a forgotten area, and it still is in the medical world, an underappreciated area and an underpublicized area. And addictions, along with mental health, are frequently areas that have been ignored. And one thing that I'm proud about with our show is that we've been able to at least call attention to it. Whether, we can debate whether it's in a positive direction. I must say, when you say 1 in 10 high school seniors have taken Vicodin, it gives me some pause. But also, certainly that's one aspect of it. Another is the positive direction that just putting these stories in front of millions of people, it elevates the awareness in the discussion, and it puts it on the radar screen. In 1994, when we were talking about healthcare reform, mental health didn't have a seat at the table. This year, thanks to the Mental Health Parity Act, the Wellstone-Domenici Mental Health Parity Act, and other legislative advances, this year it's part of the discussion. It's part of healthcare reform, and that's a huge advance in 15 years.